Hello, myself Pradhan Jyotirmay. I am a second year medical student. Today I will be performing blood pressure measurement examination on you. Is it okay with you?
Okay.
Have you had any caffeinated drinks or smoked within 30 minutes?
No.
Okay, shall we start then?
Yes.
Okay. Can you please put your left hand on the table? Okay, now I will palpate your radial artery and your brachial artery. Is it too much tight?
No.
Okay. So I will take your radial pulse now. Okay, so your radial pulse disappears at 120 mm of mercury. Because your radial pulse disappeared at 120 mmHg, so we have to implant up to 150 mmHg. So I got your blood pressure 110/70 mmHg, which is nearly normal. So thank you for your time. Have a nice day.
Thank you.
Good morning. My name is Jyoti Yadav and I am a second year medical student. What's your name?
Rashmi Yadav.
I will be examining your eyes. Is it okay with you?
Yes.
So before starting, make sure that you sanitize your hands properly so that to avoid any contaminations. Now we'll be starting with our first test, that is the test for visual acuity. In this test, we will be using the Snellen's chart. So I would like to hold this card and cover your one eyes with that.
Read the Snellen's chart from the top.
EFETOZ.
Now we'll repeat this test for the second eye as well.
Now we'll record the findings for the visual acuity test. So we move to the second test. Our second test will be the visual field test for the confrontation, and in this test, we'll be using the finger wiggle test. I want you to look straight into my eyes. I move further 2 feet apart my arms related to the patient's ears. I want you to tell you as soon as you see my fingers. Yes. Okay. Now I want you to cover your eyes. I want you to look directly into my eyes and tell me as soon as you see the fingers. Now we'll repeat this test for the second eye as well.
Now we'll move to the third test, that is the inspection. So start with the eyebrows. I'll note the hair distribution, scaliness under the skies. Moving further, I'll check for the eyelids and note the eyelid in relation to the eyeball and now palpable fissures with the presence of redness. Okay. Now we move to the conjunctiva and sclera. I'll ask the patient to look up and I'll depress both of the lower lids with my thumb. I'll see for the color change and for the swelling.
Now the fourth test is the pupillary light reaction test. In this test, I'll inspect the pupils of the patient. Now I'll darken the room and ask the patient to look ahead.
I'll flash a beam light from the sides. Swing the flashlight to the other eye. We'll absorb direct constriction of the pupil in the eye stimulated by the light called direct light reflex. The consensual light reflex can be seen in the other eye.
Now the next test is a near reaction test. I'll hold my pen 10 cm from the patient's eye. I'll ask my patient to look alternately at it into the distance behind it. I'll watch for the pupillary constriction with a near effort and convergence of eye. Now for the accommodation reflex test, I'll ask my patient to look to my finger, look to the closest finger for the pupillary dilation, and look at the further finger for the pupillary constriction. Thank you. Now we move to the fifth test, that is the extraocular movements test. In this test, cranial nerve 3, 4 and 6 are involved. Ask the patient to follow my finger as I sweep through the 6 cardinal sign directions using the H pattern. I'll make sure that my patient does not move the head. I'll check for the conjugate movements, check for the nystagmus. So the next test is a test for convergence. I'll ask my patient to follow my finger as I move towards the nose. So now we'll move to the sixth test, that is the fundoscopy. I'll darken the room so that the pupils may dilate. I'll ask my patients to look ahead. Hold the fundoscope with your right hand and use your right eyes to observe the patient's right eye. I want you to look straight ahead. I'll place my right index finger on the edge of the lens dial in order to change the lens. I'll approach the patient on 15-degree angle from the midline, shine light beam on the pupil and look for the red-orange reflex.
Hello, myself Durvesh Avinash Gana. I am a second year medical student and today I am going to perform ear examination on you. Okay? Yes. So, should I inspect your auricle?
Yes.
Okay. So, both of your auricles are fine. There is no disconformities or any lumps present. So, now I am going to check your ear canal by the help of otoscope. Okay?
Yes.
Slightly lean behind over there. Okay, your ear canals are fine, the tympanic membrane is intact. There is no serum or any discharge is present, and the tympanic membrane is properly same color. There is no change in contour, and also the malleus is visible. So, do you have any hearing loss or anything like that?
No.
You don't know?
No.
Okay, so we will proceed. First, we will do the whisper test. Okay.
Sure.
So for this, I am gonna close one of the ear, and you tell what you hear.
Okay.
What did you hear?
A2B.
Okay, for the next year now, the results are good. Now we will proceed with RNA test, and after that we will proceed to Weber's test.
Sure.
Okay.
Yes.
So for this, I am gonna use a 256 hertz tuning fork. For the RNA test, you tell me if you hear the sound in both the ears properly. Okay.
Okay. Yes, clearly in both ears.
Both ears?
Yes.
There was no sound loss in any of the ears?
No.
Okay, so now we will proceed with Weber's test. Okay.
Okay.
So for this, I am gonna place the tuning fork first on your mastoid bone, then towards your ear. You tell me when you lost the sound on the mastoid bone. Okay.
Sure. Okay, the sound's gone. Yeah, I can hear. No. Yes.
So, okay. Yeah. Okay, so the air condition is also fine. So you have good results for RNA test and Weber's test. So by the examination, we conclude that he doesn't have any ear discomfort or anything like that, and no problem is seen. Thank you.
Hello, my name is Aishwarya Pardesi. I'm second year medical student. May I know your name, please?
Drishti Pardesi.
Okay. Today I would like to examine your nose and your mouth. Is it okay with you, ma'am?
Yes.
Okay. So do you have any pain on your nose or any part of your face?
No.
Okay. Sanitize your hands before examining the patient. So now I am checking her anterior and inferior surface of the nose. I am pressing gently on the tip of the nose, which usually widens her nasal strip. With the help of bright light, I am checking her nasal vestibules. If any dysymmetry or deformity, there are none such. Now, for the nasal obstruction, I am pressing one of her align nasi and asking her to breathe by other. Okay. Now, by this one, please breathe. Okay. This is okay. Okay. So now I am checking her nasal septum with the bright light, making sure my pen light doesn't touch her sensitive septums. Her septums are perfectly normal because it has pink mucosa, straight at midline and not intact. Neither is perforated. Perforated septum can be due to direct trauma, and perforated septum can be due to the destruction of septal cartilage. Turbinates, I am directing light at her lateral walls of the nasal cavity and checking middle and inferior turbinates. They are flat and dry with the same red mucosa surrounding. In rhinitis, the turbinates may be red for bacterial and pale for allergic or viral infections with a wet mucosa. Sanitize your hands. Now, at last for the nose examination, we are checking for sinus tenderness. First, we will be checking frontal sinus by pressing on the bony brow, under the bony brow without pressing on the eyes. There should not be any pressure on the eyes. Now we are checking the maxillary sinus as well. It is normal. Now we'll start with the mouth examination. Make sure you have gloves on. Press your lips on this. We'll start with observing her lips by checking her color, if any lesions, symmetry, nodules, and moisture as well. They are fine. For the oral mucous examination, we'll be checking for lesions, ulcer, any white patches, and there are none. Now I'm checking her gums, margins, interdental papillae for swelling and ulceration. The color of the gums is usually pink. It can be brown for the dark skin tone people. Now I'm checking her teeth. Is there any misposition or is there any loose teeth? Do you have any facial pain or gum pain?
No.
Okay. Now I'm checking roof, that is palate and floor of her mouth. Is there any deformity, lesions, masses in her mouth? And there are none. Now I'm checking her tongue surface, if there are any lesions. Check size and especially sideways. If there is any ulcer or lesion, it can be sign of carcinoma. The moisture is fine. And there are no any lesions or any white patches. So it is normal.
Hello, myself Gauri Bedse and I am a second year medical student. May I know your name and age please?
My name is Komal Bedse and I am 17 years old.
Okay, so today I will be doing your oropharynx and neck examination. Will that be okay to you?
Yes.
Okay, let's just start with the oropharynx examination. Okay, so for the inspection of your oropharynx, I will be checking the color and architecture of your hard palate. Can you say ah?
Ah.
And I will be noticing the movement of uvula and the soft palate. If you are not able to get a clearer view, use a tongue depressor and do not take the depressor too far as it may cause gagging. So here we will be noticing that the soft palate rises symmetrically whereas the uvula should stay in the midline. Now you can get a clearer look for anterior and posterior pillars, tonsils if present, and the pharynx. Also look for any redness, exudates or ulceration, and normally none should be present. Now I will be examining your neck, and firstly I am going to inspect your neck and check for symmetry, size, deformity, any lumps, mass or swelling. Now observe the patient how she carries her head. Is it tilted? Is it rotated? And also note the tone of the muscles. So now I will be palpating your neck. From front side I will be palpating your posterior cervical spine, your mastoid process, the trapezius and the sternocleidomastoid. Also from back I will be palpating your thyroid gland and the lymph nodes. For inspection of trachea, palpate the trachea for any deviation from its usual midline position by placing your finger along the side of the trachea and note the space between it and the sternocleidomastoid muscle. Compare it with the other side and they should be symmetrical. For palpating the lymph nodes, you can palpate both sides simultaneously and move the fingers in a rotating manner to palpate the lymph nodes. Now, the patient should be relaxed with the neck flexed slightly forward and then palpate the lymph nodes in the following order. Firstly, the preauricular, the postauricular, the occipital, tonsillar, submandibular, submental, superficial cervical, post-cervical, deep cervical chain, and the supraclavicular. Head back a bit and inspect the regions below cricoid cartilage for any glands. With tangential lightning, you can see the lower shadowed border of the thyroid gland. Ask the patient to extend her neck backwards and then take a sip of water and swallow it. Observe the upward movement of thyroid gland and note its contour and symmetry. The thyroid gland, cricoid cartilage and the thyroid cartilage all rise with swallowing and then fall to resting position. Move behind the patient and place fingers of both your hands on patient's neck so that your index fingers are just below the cricoid cartilage. Again, ask the patient to take a sip of water and then swallow it. Feel the thyroid isthmus rising under your finger pads. Displace the trachea to the right with the fingers of left hand and with the right hand of fingers palpate the lateral part of the right lobe of thyroid in the space between the displaced trachea and the relaxed sternomastoid.
Hi, my name is Abdominal, second year medical student. Today I'm going to be doing examination of the posterior lungs. First of all, I'm going to be sanitizing my hands. Okay, good. So I'm going to be doing the posterior examination of the lungs and we'll be exposing your back. Are you okay with that? Okay. I'm going to be checking for the shape of the posterior chest, checking for any asymmetries, how it moves, and any deformities. Also be checking for abnormal muscle retractments and impaired respiration. Can you please breathe in? While she's breathing in, I'll be testing for chest expansion and contraction and asymmetry. One more, breathing again. We'll be palpating for the tactile parameters of both lungs. It is the vibration that we hear through the bronchopulmonary tree when the patient speaks. So I'll ask you to say 99 until I stop. Okay, so say 99. Now I'm going to be palpating. Palpation helps to put the chest in motion and you'll be able to establish whether it's air-filled, water-filled or consolidated. Now I'm going to be using the left middle finger, which is the pleximeter, and I'll use my right middle finger to tap on it on the distal phalanges. I'm making sure that my other fingers don't touch the body to decrease the vibrations. I'm going to be listening for any wheezing or crackling or ronchi with the aid of a stethoscope. So I'd want you to breathe in deeply and breathe out. Now I want you to say 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. Now I want you to push back 99. Don't say it out loud, just push back.
My name is Kanchan Sarkar. I am here to examine you. It is okay with you?
Yes.
Concerning problem.
Breathing problem and chest pain.
There are three key vascular structures in the neck: the carotid artery, the internal jugular vein, the external jugular vein. The carotid artery is deep to the sternocleidomastoid muscle. The extrageminal vein lies beneath the steroid-mastoid muscle adjacent to the carotid artery. The interjugular vein is not normally visible. Estimating jugular venous pressure. Jugular venous pressure reflects right arterial pressure, which is done equals central venous pressure and right ventricular and diastolic pressure. 2. JVP is best estimate for the right internal jugular vein, which has the most direct channel into the right atrium. Head of the examined table to 30 degree with the patient at supine position. Place the patient head on a pillow just to the top of the shoulder to relax the sternocleidomastoid muscle. Adjust the patient drape as necessary. Measure the oscillation point of pulsation in the right jugular vein using the following technique. Elongate triangular object such as 3-5 card from assessing the carotid pulse. Palpation to assess the amplitude and contour of the carotid upstroke. Carotid pulse. Inspect and palpate both right and left carotid artery.
Place your index and middle finger on the right thyroid artery in the lower third of the neck. Press just inside the middle border of a well-relaxed sternocleidomastoid mastoid muscle, roughly at the level of the cricoid cartilage. Turn your head little bit and hold your breath. Have the patient remain supine with the upper body raised at 30 degrees. Inspect the interior chest, noting any hives or lift none is observed. Now proceed with the palpating of chest wall. First, palpate for the hives or heel using your finger pads. Then check for the heel by pressing the ball of your hand firmly on the chest in this same location. Palpate to confirm the characteristic of the apical impulse. You will note its location and diameter and amplitude. Identify the location of the apical impulse by the interspace in which you will feel it and by its distance in the centimeter from the mid-sternal line. To the left lateral side, that is into the left lateral decubitus position, palpate against using the palmar surface of several fingers. Measure the diameter of the impulse in centimeter. Feel for the amplitude of the apical impulse. It is usually small and feel like a gentle tap, a diffusion apical impulse. I like to take breath in. Treating the carotid artery upstop as to listen the murmur is an important tip that helps to decide if the murmur is systolic or diastolic. Interspace. To better detect the more subtle diastolic murmur of aortic regurgitation and mitral valve stenosis, use two maneuvers. First maneuver, leaning forward. Leaning forward. Exhale. Second maneuver helps to detect the maneuver of mitral stenosis. Good morning, sir. I'm Albert Kennedy Afternoon Joshi meeting from MD Circuit here. I'm here to examine your abdomen, sir. Can I proceed?
Yes.
Okay. First, I'm inspecting the patient's abdomen. The patient's abdomen is rounded, symmetry with no discoloration, and there is no any marks like scars, and no any other masses, and no striations. And last, there is no dilation of superficial blood vessels seen. Now I'm going to auscultate the patient's abdomen for hearing the bubble sounds in the 4 quadrants of the abdomen. Now also I'm checking for the bruise in the aorta, in the celiac arteries, and the femoral arteries. Now I'm going to focus the patient's abdomen to determine the distribution of artery illness over the patient's abdomen. Now I'm going to palpate the patient's abdomen. First I'm doing light palpation. Gliding over. I'm checking for any tenderness in the abdomen. If you have any tenderness, tell me, sir. going to do the deep palpation. Predict any masses. Now I'm going to check for the shifting of dullness. It is to determine whether the patient's abdomen contains any kind of ascites in his or her stomach. For that, I'm going to focus the patient's abdomen from the midline to the laterally to the flank. And I'm going to note the point where the tympanic sound changes to dullness. Now I'm asking you to turn this side, sir. And again I'm going to do the same procedure and checking whether the point is the dullness to tympanic to dullness point is the same or not. Rebound tenderness in the abdomen. So now I'm going to press your abdomen deeply and gently. When I release it quickly, tell me whether you have tenderness or not. So do you have any tenderness?
No.
Thank you, sir. Now I'm going to check the Zohr sign in this patient, which is an indicator of acute appendicitis. Sir, I want you to raise your leg against my resistance, sir. Sir, do you feel any pain in the lower abdomen?
No.
So the patient is negative for Zohr sign. Now I'm going to check the patient for obturator sign. Sir, now I'm going to flex your knee and hip and internally rotate your leg. Let me know if you have pain in the lower abdomen.
No, no.
So the patient is negative for obturator sign. Thank you.
Hello, that's Suresh here. What's your name?
11,
What's your age?
21.
I'm going to take the physical examination of liver and spleen. Are you okay with this?
Okay.
Thank you. Take a deep breath. Take a deep breath. Okay. Take a deep breath.
Action.
Stop down. Take a deep breath. Turn to your right side. Flex the leg. Flex. Take a deep breath. Thank you for your cooperation.
Is it okay with you?
Okay.
Now I am going to inspect your shoulder and the shoulder girdle for any deformities or muscle atrophy or any swellings, and posteriorly scapula and the muscles any abnormal in position. Now I am going to palpate for any tenderness of the sternoclavicular joint and laterally with the clavicular. Now I am going to palpate the bone of the spine and move laterally until they reach the acromion and the acromial joint and the coracoid process and the deltoid muscle and the bicep muscles for any swellings or any deformities of the muscle, and move your humor posteriorly for the subarachnoid brusa and the subdeltoid brusa. Okay. Now I am going to do the range of motion. Follow me, and if you feel any pain, just tell me. Flexion, extension, abduction, adduction, External rotation. Manuals for the shoulder examination. Specific motion and the structure. Do you feel any pain? Just tell me and just follow me. In that abdominal clavicle joint, it is also called as crossover joint. Okay. And the overall shoulder rotation, in that it is also called as the applies costis, in that abduction and the external rotation. Okay. And the internal rotation with adduction. Okay. And rotationary cuff pain provocation test, in that painful arc test. 60, 90, 120, 180. And in a knee impingement test, now I am going to press this scapula. Do you feel any pain?
No.
Okay. In Hawkins impingement, now I am going to rotate internally your arm. And in strength test, in that external rotation lag test, now I am going to rotate externally your arm. And in internal rotation lag test, can you go backwards? Now I am going to rotate internally your shoulder. Drop arm test, can you please move slowly? And in the composition test, in that external rotation resist, comes upwards and resist externally. Okay. Empty can test, comes downwards, resist your arm. Okay.
Hello, myself Anupama Devanil. I'm a second year medical student. Now today I would like to examine your wrist. That is wrist examination I'll be doing. Is it fine with you? Okay, so to begin with, now inspect the hands for the position if it is in normal motion, and also now inspect the wrist for any swelling or on the joints or any deformities. Now observe the contours of the palm, mainly the thenar and the hypothenar eminences. Now note for any thickenings on the tendons. Now palpate the distal radius and the ulna on the lateral and the medial surfaces. Also palpate the radial styloid bone and the anatomical snuff box. Palpate the 8 carpal bones lying distal to the wrist joint, and then the metacarpal phalangeal joints. Now compress the MCP joints by squeezing inside between the thumbs and the fingers. Now note for any swelling, bogginess or tenderness. Now palpate the medial and the lateral aspects of each of the proximal interphalangeal joints between your thumb and the index finger, noting for any swelling, bogginess, bony enlargement or tenderness. Now using the same technique, examine the DIP joints too. Now repeat the same on the other hands. For the range of motion, let's begin with the flexion and extension. Now show your palms up like this and point your fingers towards the floor like this. Okay, good. Palms flat again and point your fingers towards the ceiling like this. Okay, good. And abduction with palms flat like this. Bring your fingers away from midline. Okay, and towards you. Okay, good. Thank you. I'm going to test the sensation by assessing your median nerve, the pulp of your index finger, the ulnar nerve and the pulp of your fifth finger, and the radial nerve in the dorsal left space of the thumb and the index finger. I'm going to test the strength of your fingers. Okay, squeeze as hard as you can. Okay, very good. Now grab your thumb inside your palm and fold like this. Squeeze as hard as you can. Okay, I'll be turning like this. And do you feel any pain?
No.
Okay, so this is a Finkelstein test. Okay, now to test for the carpal tunnel syndrome, let's check your thumb. Okay, place your thumb like this, straight like this. Okay, any problem?
No.
Okay, good. So this is a thumb abduction test. Okay, now next is the Tinel sign. Okay, for the median nerve convulsion. Okay, any problem?
No.
Okay, do you feel any pain in the second, third or the fourth finger?
No.
Okay, good. Now for the phalanx sign. Okay, put the back of your two hands like this together, like this. Okay, is there any problem?
No.
No. Okay, good. Thank you.
Make sure before starting any examination to sanitize your hands. Hello, I'm Talari Harshini, a medical student. Can I know your name and age, please?
Okay, my name is Nitin. I am 20 years old.
Nice to meet you, Nitin. Today I'm going to do your knee examination. Is it okay with you, Nitin?
Yes, okay.
Let me know if you got any questions about the examination.
No, it's okay.
Make sure patient should be in the supine position on the examination table with his knees in flexion. Note any deformities
or with their alignment, and also no loss of normal halos around the patella and quadriceps atrophy. Then straighten the patient legs and palpate the suprapatellar pouch on each side of the quadriceps, and noting any swelling. Now palpate the medial meniscus and then palpate the lateral meniscus. Tender may suggest a partial tear. With the knee flexor 90 degrees, access the medial compartment for any tenderness. Medial femoral condyle and medial tibial plateau, and also identify medial collateral ligament. Now access the lateral joint compartment and palpate the lateral femoral condyle, and also identify lateral collateral ligament. Access the range of motion of each knee with the beginning of extension and flexion. Support should be provided as much he needed. Ask the sitting patient to move his lower leg towards the midline and away from the midline. You have already palpated the meniscus for tenderness, 2 of the 7 major structures of the knee. To test the medial collateral ligament, perform the abduction or valgus stress test. For that, move the thigh about 30 degrees laterally to the push medially against the knee and laterally at the ankle. To test the lateral collateral ligament, perform the adduction test or varus stress test. For that, move the ankle medially and knee laterally. To test the anterior cruciate ligament or anterior drawer sign, make sure the patient knee should be at 90 degrees. Further, pull the tibia opposite side of the knee.
To test the posterior cruciate ligament,
Pull the tibia posteriorly backward and observe the backward movement of the femur.
Hi ma'am, I am Anandi. I am a medical second year student. May I know your name and age please?
Alicia, 46 years.
Okay ma'am, nice to meet you. Today I am going to check your cranial nerve. Is that okay? After knowing the patient's history and good hand hygiene, now let's proceed to the physical examination. My first physical examination is cranial nerve 1, that is the olfactory nerve. The olfactory nerve is responsible for the sense of smell. Now let's do the examination. Before that, I have to check whether the both nostrils are open. For that, I have to compress one side of the nose and sniff through the other. Okay ma'am. Now close your eyes and I will keep this in one side of the nostril and you have to identify the smell. Is that okay? Okay, thank you. Now I am going to test the cranial nerve 2, that is the optic nerve, by testing the visual acuity of the patient using a Snellen eye chart. Position the patient about 20 feet away from the chart and cover one eye with the cord and read the smallest line of the chart possible.
Yes.
Now I am going to test the visual field using a static wiggle test, positioning myself about an arm length away from the patient. I am going to wiggle my fingers. As soon as you see my finger, you can alert me. Okay? Now I am going to examine the patient's optic disc and optic fundus using an ophthalmoscope. Is that okay, ma'am? Okay. Positioning yourself about 15 inches away from the patient and 15 degree lateral to the patient's line of vision. Holding the ophthalmoscope in the right hand and using my right eye to examine the patient's right eye. By inspecting the size and shape of the pupil. Now I am going to check the patient's pupillary reaction to light by testing the direct and consensual reaction by shining this bright light into the obliquely into each pupil. Is that okay, ma'am? Okay. Now I am going to test the near response, convergence of the lines and accommodation of the lens by bringing this pen near to your eyes. Is that okay, ma'am? Now I am going to test the cranial nerve 3, 4 and 6, that is the oculomotor, trochlear and abducens nerva. Now I am going to test the extraocular movement muscles by sweeping my finger in the 6 cardinal directions like Hertz. Is that okay, ma'am? Just follow my finger without moving your head. Patient, there is no nystagmus, drooping of the eyelids or double vision. Hence, after completing all these tests, the cranial nerve of 1, 2, 3, 4 and 6 of my patients are all intact. Thank you.
Hello sir, welcome.
Hi sir, good morning.
Okay, let's sanitize our hands first.
Thank you sir.
Okay, your name please?
I am Professor Pascal, professor from St. Joseph's College, Tiruchirappalli.
Okay. I am Benny Joy. I am a medical student. So today I am going to perform cranial nerve examination on you. Is that okay for you?
Okay sir.
Before your examination, have a good hand hygiene so that you can proceed to your examination. First, let me start with testing the sensory functions of the face, which is of two types. One is light touch and the next is pinprick-like sensation. For this, we need cotton ball and broken cotton tip applicator. So, sir, I am going to touch your face with these items. Is that okay for you?
Okay sir.
Okay. Now I wanted the patient to close his eyes for the examination. So please close your eyes.
Okay sir.
Okay. Whenever you feel something, you reply me. Okay?
Okay.
Okay. Could you feel this?
Yes sir.
Could you feel that?
Yes sir.
Does this feel same on both the sides?
Yes, same sir.
Okay. Now his ophthalmic division is intact. Okay. Could you feel this?
Yes sir.
Could you feel that?
Yes sir.
Does this feel same on both the sides?
Same sir.
Okay. Now his maxillary branch is intact. Okay. Could you feel this?
Yes sir.
Could you feel that?
Yes sir.
Okay. Now his mandibular branch is intact. So the light touch is intact in this patient. Pain stimulus. Okay. Close your eyes, sir.
Yes sir, I closed.
Okay. Could you feel this?
Yes sir.
Could you feel that?
Yes sir.
Does this feel same on both sides?
Same sir.
Could you feel this?
Yes sir.
Could you feel that?
Yes sir.
Does this feel same on both sides?
Same thing sir.
Could you feel this?
Yes sir.
Could you feel that?
Yes sir.
Does this feel same on both sides?
Same sir.
Okay. So the pinprick sensation is also intact. So, first, let me look at his face for any asymmetry. There is no asymmetry seen. So next, I am going to test your muscles of mastication. Is that okay for you?
Okay sir.
Okay. Now you clench your jaw first.
Okay sir.
Okay. Let me examine your temporalis first. Next, your masseter. Now for pterygoid, open your mouth. Now don't let me to close your mouth. Okay.
Okay sir.
The motor functions are also intact. So, sir, I am going to touch your eyes with the fine wisp of cotton. Is that okay for you?
Okay sir.
So, you should look up and away.
Okay.
So, now I am going to touch his eyes with the fine wisp of cotton. Okay. Now I inspected the eyes for blinking, which is normal for the stimuli. Okay. Let me start with examining any asymmetry or abnormal movements in his face.
Okay sir.
Speak to me.
Okay sir.
Or talk to me.
Hello sir, how are you?
Okay. There is no asymmetry or abnormal movements in his face, mainly in nasolabial fold. Now, I will ask you to do some movements. Kindly cooperate.
Okay sir.
Now raise your eyebrows. Okay. Now frown. Okay. Now close your eyes tightly. Don't let me to open it.
Okay sir.
Okay. The muscular strength is good. Now show your upper and lower teeth. Okay. Now smile. Okay. Now push your cheeks out. Don't let me to push in it. Okay. Good. Now let me test your sensory function.
Okay sir.
So, sir, you please goggle or wash your mouth and come.
Okay sir.
Take your seat, sir.
Thank you sir.
Okay. Now I am going to test the anterior tongue for the sensory function. Okay. Sir, now I am going to place a drop of solution in your right tongue.
Okay sir.
So open your mouth. How is it?
So sweet.
Okay. Place a drop of solution in your left tongue.
Okay sir.
How is it?
It is salty.
Okay. Thank you.
Okay sir.
So first is whispered voice test. Okay. Repeat what I say.
Okay sir. 4U1.
Okay. Now
7U5.
okay. Now it's radio test.
Yes.
You hear the sound?
Yes yes.
You hear the sound?
Ah, very clear.
Which sound did you hear the maximum?
The second one.
Okay. Now the Weber test.
Very clear.
Did you hear this in 1 year or both ears?
Both ears.
Okay, thank you. Sir, thank you for your cooperation.
Thank you sir.
Please wash your hands after completing your examinations.
So I would like to examine your cranial nerves. Those are hypoglossal nerve, vagus nerve, spinal accessory and oropharyngeal. Is it okay with you? Yeah, absolutely. Okay, thank you, Chandu. We'll start in a few minutes. Okay, Chandu, I'm going to start with oropharyngeal nerve. Now, I'm going to access your mouth. Can you open your mouth and say ah? So I'm going to check this off palate and uvula movements. So it's absolutely good. Okay, thank you. Can you close it? I'm going to grab reflex. So please open your mouth. Yeah, 1 second. Yeah, it's good. Thank you. Chandu, can you just cough for me? Okay. Can you please drink some water and swallow it? Okay, it's everything. I'm going to examine your spinal axis now. So I'm going to put some force against your neck and shoulder. Do not panic, right opposite. Can you shrug your shoulders so I can examine the trapezius muscle? Thank you. So now I'm going to put my hand against your head, right opposite. So I'm going to examine this sternocleidomastoid muscle. Can you oppose it again? Okay, thank you. So now we'll go with hypoglossal nerve examination. Can you open your mouth? So I'm going to inspect your tongue for any fasciculations. Okay, can you put it out? There are no deviations. There is no nerve damage. Okay, thank you. Can you put your tongue against my fingers? So I can inspect any weaknesses. Thank you. And now we'll go with reflexes. So first we'll start with bicep reflex. Please fold your hand. Please put your elbow partially flexed. Then I'm going to reflex this hand. I'm going to bring this hammer over the bicep tendon. Please put your arm on your lap. Okay. I'm going to strike the hammer about 1 or 2 inches out from the wrist. So I can see the flexion and supination of the forearm. Thank you. Now we are going with biceps reflexes. So please put your arm free. So can you please put it for an angle. Thank you. This shows C7 and C8 reflexes. So as I deal with the hammer, so we can see the extension of the elbow and contraction of the triceps. Now we are going with the knee reflex. As the knee is flexed, we are going to tap on the patellar tendon at the below of the patella, so we can note the contraction of the quadriceps with the extension of the knee. Angle reflex. So please put your foot in the dorsiflexor angle. So now I'm striking on the Achilles tendon to watch the feel of the plantar flexion into the angle. I'm going to do Babinski reflex. So now I'm using this wooden end and I'm going to strike it in the lateral part of the sole. So now we can see the dorsal reflex of the big toes. Yes, thank you. Just do Jonas reflex. I am going to lift this knee partly in a flexed position. Now I am going to do dorsal and plantar reflex. Is there any stimulus? No. Okay, thank you. It's a normal condition. Thank you, Chandra. Thank you for your time. The examination was very good. Everything is normal. Thank you.
Hello sir, my name is Anta. May I know your name? Nice to meet you, Jepa. Now I am going to perform some tests to check cerebellar system to observe the rhythmic movement and study posture. Now, is that okay for you? Okay. Now I am going to perform rapid alternating movement to observe the
speed, rhythm and smoothing. For this test, you have to follow my actions. Can you repeat with other hand? Now, I am going to perform rapid after neck movement on legs. Jaipal, please tap your foot on my hand. Can you repeat with other leg? I am going to do finger to toe test to observe the accuracy, smoothness, watch for tremors. For this test, you have to touch my index finger and your nose alternatively at several times. Can you repeat with other hand? Next, heel to shin test. For this test, you have to place one heel on the opposite knee, then run it down. Can you repeat with other leg? Okay. Next, giant test. For this test, you have to walk. For tandem walking, you have to walk like this. Walk on twice. Walk on heels. Now you are going to hold one leg. Is that okay for you? Now you can do it. Can you do it other leg? Okay. Now you have to shallow knee bend like this. Can you repeat with other leg? Now I am going to perform sense of position test, is rumble test. For this test, you have to stand and feet close together and close your eyes for 30 seconds. Now I am going to do pronated drift test. For this test, you have to keep both arms forward and palms up. Close your eyes for 30 seconds. Thank you, Jaipal.
I am second year medical student. I am going to examine your sensory function. Is that okay for you?
Okay.
Okay. Before that, I will sanitize my hand. I am going to test the patient's ability to perceive sensation. Before that, I will check the symmetry of the arms, legs and trunk. Okay. Now, let us start our procedure. First, pain sensation. Pain sensation. By using this safety pin of sharp and dull point. I am going to place it on any parts of your body. You have to tell me whether it is sharp or blunt. Close your eyes.
Sharp.
Now, temperature sensation. Temperature sensation is usually omitted if the pain sensation is normal. But if there is any sensory deficit, we can use this tuning fork by heated or cooled by running water. Okay, I am going to place any parts of your body. You have to tell me whether it is cold or hot. Close your eyes.
Cold. Hot.
Okay. Now, superficial tactile sensation, which is a light touch. Okay. By using this fine viscous cotton, I am going to place anywhere on the body. You have to tell what you have felt. Okay. Close your eyes. Now, sensitivity of vibration. For this, I am using this relatively low pitched tuning fork of 128 Hz. I am going to tap on my hand and place it on the wrist or shoulder. You have to tell me when the vibration stops. Proprioception. Joint position sense test. In this, I am going to grasp the patient's greatest toe and pull it away from the other toes. Okay, close your eyes and tell me whether it is up or down. Okay. Discrimination sensation. First, you are going to test the stenognosis. For the stenognosis test, it is the patient's ability to identify the object only by feeling. Close your eyes. Tell me what the object is.
Key.
Close your eyes. What the object is.
Fine.
Now, graphesthesia, number identification test. For this, I am going to write any letter or number on your hand. You have to tell me what it was. Close your eyes.
3, 5, 2, 5.
Now, 2-point discrimination test. For this, I am going to take 2 pins and I simultaneously tap any parts of your body. You have to tell me whether it is 1 touch or 2 touch. Close your eyes.
2 touch. 2 touch. 2 touch.
Okay. Now, point localization test. For this, I will touch any parts of your body. You have to close your eyes and tell me where it was spotted. Close your eyes. Extinction phenomenon. Extinction phenomenon. I will simultaneously touch any identical parts of the body. You have to tell me where it was. Close your eyes. You are normal. I will sanitize again. Thank you.
Hello, good morning. This is Chandra Kanimori Vishali, second year medical student. I am going to examine the motor system of lower extremities. It's okay for you? motor system, we have to first examine the body's position, involuntary movements, characteristic of the muscles like muscle tone, muscle bulk, and especially the muscle strength and the coordination of the muscle.
Observe the patient's body position during the movement and rest. Inspect there is any skin lesion and cyst presence in the legs. There is any involuntary movement such as tremor, fasciculate and tics, and any location of rate, rhythm and amplitude. To assess the muscle bulk, we should inspect the size and the counter of the muscles. The muscles whether look like a flat or concave, and whether the atrophy or the muscle wasting is also present. In atrophy, we should particularly inspect the thigh and the legs.
To assess the muscle tone, the resistance occur to your movement. Tense patients show increased resistance. The muscle tone, support the patient's thigh with one hand and grasp the foot with other. Flex and extend the knee and ankle. Note the resistance movement of your limb. Muscle strength, the flexion, extension and other movements of the major joints are tested. Lying on supine position on the examination table, test for hip flexion. Place your hand on the patient's thigh. Please place your leg against my hand. Now relax it. Test for the extension of the hip in the gluteus maximum. Place your hand on the patient's posterior thigh and please push your leg against my hand. Okay, next question. For the adduction of thigh, place your hand in between the patient's knee. Can you bring your legs closer? Okay, relax. For the abduction of the thigh, place your hand outside of the patient's knee and ask them to move their legs against the hand. Okay, relax. Test for the knee flexion at hamstring muscle. Position the patient's leg. The foot must be rested on the bed. Can you push the leg against my hand? Okay. Test for the knee extension in quadriceps muscle. Position the patient's knee. Can you straighten the leg? Okay, rest. Test for dorsiflexion and plantar flexion. Now place your hand on the patient's foot. Now pull up your dorsiflexion. Okay, relax. Then push down the plantar flexion. Okay, relax. Heel and toe work also assess the dorsiflexion and plantar flexion.
What's your name?
My name is Shukar, ma'am.
Are you feeling fine?
Yes, I'm fine.
Okay, let's start. Observe body movements during rest and during motion. Watch for involuntary movements such as tremors, tics and fasciculations. While looking for atrophy, pay special attention to shoulders and hands. Then we have to do muscle tone for passive stretch. Take one hand in yours and while supporting the elbow, flex and extend fingers, wrist, elbow and put shoulder through moderate range of motion on each side. While assessing muscle strength, note the dominant side is usually stronger than non-dominant side.
Shoulder abduction, shoulder adduction, elbow flexion.
Bend your elbow and place it on table. Put your wrist just off the table so you have some movement. Make fist with hand and just turn it on both sides.
Wrist extension, finger extension.